I'm Dr. Manju Appathurai, and this is The Center Edge. My passion for these conversations comes from my own journey. This podcast is an effort to translate that lived experience into something meaningful and positive. Now, let's get into the episode. So let's begin. I'm Dr. Manju Appathurai, and this is The Scented Edge. And today we have with us Dr. Rakesh Subbiah, and he runs a very interesting clinic.
Yes, I do.
And he has a very interesting passion for his field. So Rakesh,
Yes, I do.
please.
I run a men's clinic. I am the head of clinic and wellness there. And we have two branches. What we deal with is basically men's wellness, men's health. And of course, on the surface, what springs to mind would be conditions like erectile dysfunction, premature ejaculation and whatnot. But I think it's way more than that. It's regarding society and how we perceive men and men's health in general.
Because like you yourself mentioned, the general misconception is anytime it's a men's health, it's all about the penis.
Exactly.
And we even have a thing about mentioning penis, right, Sam? I mentioned the word penis.
You can mention that. Well, I think a lot of people stereotype and there's a lot of taboo and stigma regarding this. But the main issue is that a man who has been consistently conditioned by society to feel this macho aspect, to feel this sort of like pride, yes, he will only seek help when his penis is in danger. But that is just an initial warning to what could take place later.
So picking up on that, let's say a 40-year-old, he suddenly get it out. And so is the penis then a warning signal? Something else about to happen, a stroke?
Well,
whatever?
research has been done, and some would say that since the small vessels are affected in the penis, then that would point to other sort of things happening in the next 6 months, 3 years, 5 years, something like that. Possibly to do with the heart, to do with maybe having a stroke and whatnot. But of course, it's not confirmed. However, it's a symptom. For example, if somebody were to go to a regular GP with a symptom of a cough and a fever or a sore throat, they have a bacterial infection or a viral infection. If somebody came to me with issues of not being able to perform, that's a symptom. A symptom of what? Because it's not like the penis is not attached to something else. It's attached to your body. So we have to go in deeper. And what we do is we have to go from square one again, the blood investigations, and we need to find out what the issues are. A lot of times they are undiagnosed diabetic patients. They are undiagnosed hypertensive patients. They have high uric acid. They might have high inflammatory markers. And most of them have low testosterone, which is the male hormone.
I want to ask you from the perspective of a psychologist, right? You mentioned conditioning of society. The penis for guys, and how it performs, it's very much tied to the masculinity and their self-image about themselves.
Yes.
So how much of the patients that you see are actually having some sort of a physical condition as opposed to how many of them are actually having a psychological condition?
That's very interesting. Me being someone who was in psychiatry for a while, I do have some experience with that. But it's surprising here actually that it's mostly physiological. When I say that, it is because they do come in with low confidence, with a lower level of that sort of machoism, because they feel that they are defeated. They feel that when they cannot perform, a part of them is lost. But when I go through their physiological aspect, when we do the blood investigations and stuff, oftentimes we see their hormonal levels being low or certain other issues in their body. Maybe they have low iron or low hemoglobin or something like that, a lot of inflammation. So when we correct that alongside with their lifestyle, we do see their emotional aspect like getting much better. So we do that aspect. We do the physical aspect as well. We have an on-site partner, fitness trainer, physiotherapist. So they help with that. So we can see like from the first visit to the third visit to the sixth visit. So like, for example, you can see a broken man coming in on the first visit, practically in tears. I've had patients even in tears in front of me with their wives next to them. And it's hard to see, but we know that we can push them up and bring them out. So once we do what we do see them getting much better emotionally. I'm not saying that the psychological aspect is not there. We don't emphasize on it. But if the patient is at that certain level, for example, if they're experiencing severe porn addiction, certain other things like that, then I might refer them onwards. But so far, with my doctor's capabilities, we are able to solve their issues without having to delve deeper into the psychological aspect.
So what are the full services that you provide? Because you said you have sister partners as well, right?
Yes, we're like a complete one-stop center. Let's say patient journey, right? Patient comes in, registers, and you see the doctor is going to take your history and get all the information that they need, then they're going to recommend doing a full blood investigation unless you've had that done before. So we can analyze that. We also do have certain modalities that we use. Of course, this is directly for men's health. So we do use technologies such as sound waves to help with blood flow of the penis. We do use other invasive treatments using regenerative therapy as well for the penis. In addition to that, we have certain drips that we do use that are, of course, under the gen, and that is mostly for energy and stuff like that. We also use a lot of supplementation. Being a clinic, we also do have medication, but medication is like supplementary. We're trying to fix the root cause. So this is the clinic aspect. What we also do here is, let's say the person doesn't come in for the penis and comes in for other aspects, brain fog, low energy, maybe high stress individuals. So we can use still the same similar system to combat that. So now we have our sister partner, which is our wellness center, has a fitness trainer and a physiotherapist. So what we do is undertake a package with us that they will actually have sessions with the fitness trainer and the physiotherapist, because we believe that their problem or their issue, it's just not going to be solved medically. It has to be solved by changing their entire lifestyle. And this has to do with their sleep, their stress levels, their diet, their exercise, and also probably substance use like cigarettes and alcohol and stuff like that. So our fitness trainer, our coach will help out with that aspect. And then our physiotherapist will help them to deal with their issues at home. So helping their pelvic floor, helping certain other things, because as we age, I know because I'm a 44 currently, so I can feel it when I wake up in the morning, aches and pains. Our physiotherapist will help with that. He even helps with other aspects such as lower back pain, knee pain, and so forth.
Do they mostly come in with their wives, or do they come in alone?
It's a mix. Once my team makes contact with them, we do ask them to bring their wives together, because their wives might not have the understanding. And a lot of wives, they have the misconception that the reason why their husband cannot perform is because they're no longer attracted to them.
Yeah.
And that's a very sad thing, because that's the last thing. The man is dealing with so much. He's already very stressed out. Usually we get a lot of high-level individuals. They are very successful in life in terms of financially and stuff like that. But when it comes to this aspect, they're unable to perform. And that's because of the high stress levels, maybe the high cortisol levels leading to the low testosterone. And the wives do not understand this. That's step one. So when the wives do come, we involve them in the explanation, involve them in the discussion. So we break the stigma and taboo so that they start understanding this goes further. My husband is unwell. My husband has an illness. It's a disease. Just like when we talk about psychiatry or psychology, we talk about depression, we talk about bipolar. Society cannot accept that to some extent. The same thing happens here with men's health. Cannot accept that is a diagnosis or an illness. In fact, if you were to go to certain centers, they will just brush it off and say, why don't you just take this medication? But that's like putting a Band-Aid on a festering wound. You're not actually healing the wound. You're just putting on a Band-Aid. And after a while, it's not going to work anymore.
So do Viagra, and nowadays a lot of ads for Hawthorne or all these supplements.
There's supplementation, and then there are PDE5 inhibitors, which is medication and stuff like that. Okay, let's talk about PDE5 inhibitors. Basically what it does is it blocks a certain enzyme which increases nitric oxide and indirectly causes an erection. We do use these, but we use it at a lower dosage while we are giving their other treatments or therapies. And what we are trying to do is to supplement it initially, but later on we try to wean it off. And we don't want them to be dependent on it. We don't use it as a crutch or as the end all something. And when it comes to supplementations, there are many supplements that are good, but you have to sieve through the many supplements to understand what is beneficial and what is not. We've done the research. We've all been guinea pigs ourselves, and like we're all trying to keep going. At my age, I know that for a fact.
Let me ask about morning glory. Is that a must? Anyone doesn't know, that's when you wake up with that erection. Is that a problem?
Well, we don't really call it such a nice term. We call it morning wood, but morning glory is fine. There are many schools of thought. There are some people who believe that at the age of 20, you should have it daily. 30, you should have it maybe 5 to 6 times, and then so forth, changes based on age. But I've had a lot of experience with many different patients whereby they do not have it in the morning. Maybe they have it throughout the day. That's one. The second thing is older gentlemen, they tend to not be able to have the morning wood as often, but they're able to perform once they do our therapies. So yes, it's an indicator of optimal hormonal level. It's an indicator of good blood flow. It's an indicator possibly of some sort of good nervous system there and so forth. But I would say it's not 100% must.
That came across this massage technique that they use on the penis to get the blood flowing. Is that a real thing?
mostly men are obsessed with their penis. Maybe the massage technique that you're talking about is called jelking or something like that, but that goes back thousands of years. There is some truth to all of these sort of massage techniques, but the issue right now is that it's not governed, it's not controlled. There are a lot of people with unsubstantial claims claiming that massages can heal everything. Basically, they're trying to improve blood flow. In our center, our sister wellness center, our physiotherapists, they do something that we have coined mindhood massage. It's something that is similar, but there's no actual contact with the penis. Okay, so it's to improve blood flow, but it's always in supplementary to the other treatment methods, because what we're trying to do is to improve blood flow. I think everything has to be taken with a pinch of salt when they advertise outside regarding massages and so forth, because it's usually short-lived. And we have also seen some people do massages at other centers, and it's caused more harm than good. So that's a bit of a danger as well.
You mentioned this in the course of conversation, but I just want to highlight it. Well, aside from stress, what else causes the non-performance of penis?
So stress is one aspect. So usually I go through the basics: lack of sleep, there's stress, then there's the poor diet, because as we know currently diet, we are mostly consuming ultra-processed foods. There's a lot of, they found plastics in our foods that is disrupting our hormonal levels, and all the ultra-processed foods plus high fructose and whatnot. And they have very bad sources of protein as well, and low levels of good fats, which is the precursor to create hormones. And then there's exercise. There are many extremes. There are mostly the sedentary lifestyle of us being in front of the computer and not actually exercising. But then we have the other extreme where we have these people obsessing about joining high rocks and ultra marathons and everything. That's also extreme. So we see these two people, the sedentary and the extreme, both have very low levels of testosterone. You need to be consistent, and you need to be, basically consistency. So three times a week, weight training, and then maybe once or twice cardio. And cardio, you wouldn't want to do it too much, like 30 minutes, something like that. So that's where our coach comes in. I'm actually also a certified fitness trainer, but I do not practice at all. I kind of practice what I preach. I try to do that as well. So we're talking about sleep, stress, diet, and exercise. And then it comes to the substances. So definitely have to cut down on nicotine, or actually quitting. There are no benefits from it. And even alcohol. Although they have done several studies previously saying resveratrol, then take the resveratrol supplement. Do not consume alcohol, because there's no benefit actually to that. It's a poison. And of course, other substances. And this is to do with their medical conditions, such as diabetes, like I mentioned, hypertension, gout, certain other aspects as well. Some patients, we've had patients who are cancer survivors. We've had patients who are survivors from traumatic events, but neurogenic is much harder to, sometimes we're not able to treat it. Even certain cancer survivors, usually when they do come in, I'm like, we can give it a try, but we have to see how it goes. Yeah.
Just explain a little bit about the neurogenic condition.
Well, neurogenic conditions would be where the sacral plexus is actually affected. So once that is affected, that's to do with nerve endings and everything. So they might need more aggressive treatments, such as injections directly into the penis, or maybe surgery where they actually have a pump into the penis. We do not do that. That's done in the hospital setting.
Let's talk then about the type of therapies that are there. I know about testosterone replacement therapy. What other radical treatments are there?
We talk about non-radical first. What I mentioned was lifestyle change and supplementation, and also like certain kinds of IV drips and so forth. And then we talk about testosterone replacement therapy. That's one modality. But usually when we talk about testosterone replacement therapy, we have to ensure that the patient doesn't have thick blood, polycythemia is high. We have to ensure that their triglycerides is not high, which is cholesterol. We have to make sure that their tumor markers are not raised. So there's a whole monitoring that is going on in regards to that. But the issue currently is that a lot of people do testosterone replacement therapy on their own, especially those in the gym bros, and they are going to be having a lot of unwanted experiences whereby they are sterile, they're unable to have children because their sperm count drops, their testes shrink, and then they have a lot of very bad side effects, probably thickening of the heart, myocardium. That's why we do see a lot of bodybuilders getting heart attacks at young ages. So that's why testosterone therapy, I only prescribe it to people who are ideal candidates, those who have completed their family, those who they understand the risks and they understand what they are doing. But I usually try to do that more for my elderly patients, like older patients who have completed their family and who are safe. Then we have other therapies where we actually boost a signal from the brain, the pituitary gland that sends a signal to the testes. So that we boost another hormone called LH, luteinizing hormone, also FSH for fertility. So we boost that, and then that indirectly boosts the testosterone. And we use certain other supplementations, and actually homegrown supplementations such as Tongkat Ali, but that is actually Like when people hear that, they brush it off, but actually there are different levels and gradings of that as well. So that is to do with hormonal therapy. So when we talk about the penis, we do have certain modalities that we use in our wellness center, where we use sound waves to improve blood circulation. This is actually something that has been clinically proven. They have done studies abroad and it's being used widespread. It is very safe. There are no side effects. But of course, there are many schools of thought. But having used it in our wellness center and having practiced for quite a while, we do see huge change with that in regards to blood flow, in regards to their performance and so forth. Next, we target the pelvic floor. So of course, we do try to advise them to do Kegel exercises at home and so forth. But in our wellness center, we do have the Kegel sort of machine whereby they are able to just sit on it, because most people are unable to consistently do something on a regular basis. And so it's able to generate electromagnetic forces that causes the contractions to strengthen the pelvic floor. So that helps with the erection. It helps with being able to last longer, premature ejaculation, and so forth. Then we have certain other aspects which we go deeper, which are a bit more on the global scale. Some of it is experimented and also well practiced. So we do certain other aspects of that when it comes to regenerative therapy. So we do it when it comes to the full body and also on the penis as well. So that we do see a lot of changes with that as well.
I want to ask, women have menopause, but is menopause a real thing?
So menopause for women, andropause for men. So it's a different term.
I've always been curious why men is there in the menopause for women, but please continue.
Probably that can change soon, right? The movements and everything right now. The difference between menopause and andropause is menopause, it's widespread. So you get the hot flashes and you know that is happening. Women's health is more widespread and we have had it. Obstetricians, gynecologists, it's not stigmatized. If you come back to men, they are not told regarding this. Grumpy old man syndrome, if we were to walk around malls in our own country, we will see men maybe over the age of 50, 60, 70s and above. Possibly they're grumpy because probably their hormonal levels are low. The testosterone is low. So there's a gradual decrease from the age of probably 35 and above, but I've seen it even younger. I'm 44, so I've felt it. I myself have done certain therapies on myself, and in addition to supplementation, lifestyle change and whatnot. So andropause is gradual, but it does happen, and it's a real phenomenon, and we do see it with our patients, but it's happening younger and younger.
And is that because of the soy, the microplastics?
It's a lot of things. Let's rewind back to the 1970s. We have the macho Marlboro man. Of course, he actually passed away from lung cancer probably. So let's not say he's that macho, but that was the ideal male at that time. And being a man, being a strong provider, leader of the family was something that was acceptable. I'm not saying that the movement is wrong currently for women's rights and everything. I completely support it. But I think it has been misinterpreted for men. So men believe women prefer passive men. They prefer men who are easily agreeable, those kind of like submissive men and stuff like that. That's not actually the case. If you really talk to a woman, that's not what they want. They want somebody who respects them, somebody who is there for them, and it's more of a partnership. But there still has to be a certain sort of role that a man and a woman has. This might be controversial when I say this, but it's because biologically we are built that way. So for example, a very high achieving woman, CEO level, I've dealt with these women before because I don't only treat men, I do treat women at times. We would see that she might not be able to conceive easily because that drive, that maternity drive is suppressed. And the same thing happens with the men where they are being more submissive, they're being more passive. So we see their levels drop. They do not have to be the hunter, the predator. No, they have to be maybe the caregiver. The provider is something else, but like the caregiver, the passive thing. I think I was reading some statistic before coming in here today. Testosterone or hormonal levels have dropped like 1% per year. I don't think it's to that level, but I know that if you were to compare somebody in the 70s and somebody right now, the baseline of male testosterone is very different. It's very low. That's why sometimes I see these like older gentlemen, 60s, 70s, coming from military backgrounds, their testosterone is off the charts. They still have ED because of other issues, but their testosterone is off the charts. And I'm like, did you take any testosterone there? No, nothing. No.
This podcast is supported by Work. More than just a co-working space, it's an ecosystem built for human connection. So whether you're established or you're a startup, find room to grow at Work. Let's talk about fertility for a little bit, because it's not just women who have problem conceiving, what makes the sperm count of a man drop?
It's going back to all the aspects that I discussed previously. It's quite basic. Basic is something that we take for granted. Poor sleep, stress, lack of exercise, poor diets, and substances. We have another signal from the brain called FSH, the follicular stimulating hormone, that sends a signal to the testes to make sperm. So we see that pretty low in general population. They have a low level of the luteinizing hormone and they have a low testosterone. So we try to boost that up and push that up.
How is pregnancy affected when men help with conceiving at a later stage in their life? Because there was a recent study that said autism increases as the male gets older. So what are the different conditions that happen when men get pregnant later in life?
Usually, if they are fairly healthy and if things are okay, there shouldn't be a huge increase comparing like a woman's age, because that's like the person who is giving birth and carrier and everything like that. However, yes, they do have some studies like you mentioned regarding autism, but I don't think it's completely backed yet regarding all that. But yes, I'm sure that there are certain conditions like possibly trisomy 21, certain things like that might increase with age. But you will see elderly gentlemen like 50s, 60s having completely healthy children as well. Of course, a lot of people are not really conceiving naturally. There are a lot of people using IVF and whatnot. So when that aspect is there, then there's a reduction in those sort of other issues.
One of the major questions that we get that people ask, does size matter? And is the shrinking penis a sign of atrophy that can be reversed?
In regards to size mattering, we are Asian, so we have to be realistic. I have men who constantly asking me, doctor, could you make it bigger? Could you make it longer? But what they don't realize is, yes, you can have it increase in size, but that's transient. It's not long term. We do not do it at my center. And it is very costly. And it's not going to fix the underlying issue of being unable to perform. And we do try to discuss with the wives as well in our setting. And most of them are totally fine with the size. It is that the performance, the duration, the strength and whatnot, that is what they are more worried about, because Asian men are built for Asian women. We are not from a different region. So we are average for our size. So in terms of shrinkage and atrophy and stuff like that, it's not actually true atrophy. It's number one, it could be due to your body. So fat pads increasing and everything like that. So there is that sort of hidden penis syndrome, but we rarely get that. The other aspect is just the basic poor blood flow. Once we fix that with our therapies and with other things, we can actually see the penis going back to the previous size.
Do men know how to have sex? Is the pleasuring of women something that needs to be thought? I'm going to ask you two questions at once. The next one would be about porn addiction, because you get in 4K high resolution and you get the dopamine, and then would you be able to replicate that in real life?
Basically, the men who come to us, they are a bit more in touch with their sexuality and everything for them to, I've already thought 10 times to actually come to a men's health clinic. So they do care in regards to satisfying their partner. So I don't go in detail in regards to clitoral stimulation or G-spot stimulation and everything with them. But if they do need any help, I do go in detail with that. And especially because they want to be able to last a certain duration in order for their wife to have that satisfaction, because women usually tend to need a longer duration.
And then the porn addiction.
Porn addiction is very common in Malaysia, especially because our society is a very prohibited society. So in prohibited societies, we tend to have a lot of individuals accessing these sort of things in their free time or while they're in private. So we see a lot of these individuals coming to us before marriage, noticing certain things like no morning glory and stuff like that. With these individuals, we see that they tend to have lower testosterone as well. They tend to have other issues, poor confidence and stuff like that. So what we do is we try to move them away from those sort of dopamine stimulators and bring them into the healthy living, probably adequate amount of sleep, exercise, that kind of thing. And when we move them towards that, alongside with our therapies and our supplementation, we see that they get the self-confidence. And then what we say is you need to focus on your partner. Focus on your wife or your partner. Focus on your future wife. If you do still have to perform masturbation and whatnot, do not use pornography. Use a certain image of the person who you are going to be with or something like that. I'm not somebody who's going to say you shouldn't do it, but there's so many studies out there saying you should or shouldn't, protection against prostate cancer and whatnot, but nothing is 100%. So everything in moderation, but definitely accessing pornography, using those kind of stimulation is a complete no-no, because the issue is that when you do that, it's fantasy, it's not reality. You have unhealthy habits, and the stimulation from that you will not be able to achieve in reality, because pornography right now, it has gone to extreme levels.
Masturbation, something that's important, it's healthy to do. How does one regulate that?
I personally do not think it's that important, especially if you have a partner, because if you're already having issues with ED, you need to conserve all your sexual energy for that partner. If, let's say, you do not have a partner, usually you are in your younger age group and you are curious and whatnot. Of course, everybody's going to go through that, but you do not need to do it on a regular basis. So there's no right or wrong answer that. I'm not going to commit myself to that answer. But is it necessary? Possibly not. There are some people who, I think they have certain movements where they do not do it and they claim that's going to increase their hormonal level. But there's the other extreme that says that if you do it on a regular basis, you're going to protect yourself from prostate cancer. But so just take everything with a pinch of salt and try to decide what is best for you. But I always believe that you need to focus on your partner and you need to focus on the actual act, because when you do have relations, other hormones are released as well, like oxytocin and stuff like that, which doesn't happen when you do pleasure yourself.
Very cliche. Two French friends who told me that French men generally can keep it up for longer. So is there a way to move from the minute man to someone who lasts for a longer time? Is there anything that can be done for that? Or is that purely a mental conditioning?
Okay. Firstly, regarding the French men, I think I would never believe anything that I hear from men ever. You have a typical coffee shop atmosphere. You have 5 men boasting, being able to last half an hour, 1 hour. It's completely false. Men tend to exaggerate everything. Like I mentioned, going from the blood test, supplementation, improving the pelvic floor, reducing the sensitivity of the penis head and the glans penis and also the shaft of the penis. When we do all of it together, it's not just one thing. We are looking at the patient on a holistic level and improving their self-confidence and everything. And then they can get to that, because most people, they just assume, this is me, this is what I am, and this is what I have to accept. But we have the science, we have the technology, we have the knowledge. But of course, I'm not going to say that this happens all the time. It is based on individual. The biggest question is, doctor, do you have a guarantee? I'm not selling cars here, but even a car salesman is not going to guarantee that the car is going to work forever. But I'm a man, and I am trying to make society better for men.
Going back to treatment, one that I hear quite often is P shots, stem cell injection directly into the penis. So is that real? Is that snake oil?
Stem cell therapy right now, it's garnering a lot of attention in the world. There's some experimentation. There are certain labs that are accredited, and it is being performed in general. And I would not say it's snake oil, but of course you have to ensure that you do obtain the stem cells from accredited labs. So you need to go to a certain center that has all that. So you have to be able to sift through a lot of aspects and a lot of unscrupulous people trying to say that this is a stem cell, that is a stem cell. Even the other day, there was somebody who was consuming fish stem cells saying that's going to work. And no, it's not snake oil, but you have to have the right sauce and the right everything, because what it does is when you do the P shot for the stem cells, the immature cells can differentiate into other cells. So differentiate into blood vessels and so forth. It will actually have a paracrine effect whereby other cells will be called towards that location to restructure and regenerate. So it definitely has a lot of benefit, but you have to ensure that it's done right.
Another trend that is very popular is the longevity trend, right? Everybody's trying to live till 120. I personally am going to live until 120.
Okay.
As men get older, what ways are there to ensure that they still can perform?
Usually it's actually to do with the basics. I'm trying to live till 120 as well. And it's simple things. You have to sleep on time. You have to wake up on time. You have to follow the sun, circadian rhythm. You have to make sure that because hormones are mostly secreted at night. You have to ensure that what I tell my patients is every single time you actually consume something, whatever you put into your mouth, that's like going to the gym. So you have to ensure that from the morning till the night, like whatever you consume is carefully selected. Well, you don't have to be so obsessive, but it has to be there. So you have to stay away from processed foods. You have to stay away from trans fats. You have to stay away from seed oils. You have to stay away from a lot of things. I have blood diets that I usually prescribe. So like different blood groups, what is more ideal for you. different type of body types, that kind of thing. And then again, going back to exercise and whatnot, and then supplementation, that's a huge thing for men. So you have supplements basic supplementation like vitamin D, iron, also certain supplementations which will boost hormonal levels, like I mentioned, Tonka Ali, Shilajit, ashwagandha. And you have to know how to use them. Like all of a sudden they were talking about turmeric and everybody went nuts about turmeric, but they don't realize that if you overconsume turmeric, that's going to cause your testosterone to drop. So people have to be very careful. Green tea, everybody's obsessive about that, but then that's going to cause other issues as well. So you really have to have a balance. You have to have the knowledge. Then there are shortcuts as well when it comes to longevity. So certain supplementations and IV drips and so forth. So like those kind of things you can always come and discuss with us. And you have to understand that only people who have the knowledge, only people who are doing it themselves, are practicing it themselves would be the best people to get the treatment from.
But what are the general food that men should avoid or the food that they should be taking?
For men in general, I would say they need a good source of protein. Usually, surprisingly, red meat actually is quite good. However, you need to find lean red meat. You don't have to look for organic, but lean red meat, because that would be a good source of vitamin B, iron, and also good fats. Then we talk about good fats. Good fats, probably something like olive oil, avocados, walnuts, pistachio, all those kind of expensive food groups. But that would push up your HDL, which would help with production of high testosterone. Foods to avoid generally would be stuff like high estrogen foods, soy, chicken to some extent, because they do consume soy products, certain other things, but mostly high estrogen foods. But if you were to see a regular Malaysian man's diet, basically you just need to avoid a lot of the foods that are there already. It's very tough for us because when we go out, it's hard for us to make proper choices. But in general, try to stay away from fried foods, try to stay away from highly processed foods, try to stay away from the typical burgers, sausages, those kind of things, cereals, those kind of things. So eat fresh foods and healthy foods. It's easier said than done, I know that.
As Asians, we are generally quite religious. Are there any religious barriers for men to seek treatment or to seek help?
I wouldn't say that it's religious, there are any barriers, because I think in all religion, as far as I know, in Islam, they are obligated, Martin, so to actually perform with their wife. And I'm pretty sure it's there in other religions as well. I don't think religion is a barrier. It is more the stigma and the taboo.
You also said sometimes you treat women as well, right?
It's pretty rare, usually their wives. So like we do full blood investigations regarding them, and then we help them with weight loss. So we also help them with, some of them with their pelvic floor. We don't go really deep into women, but in the future we might.
Have you saved marriages?
Yes, definitely. Because as I mentioned, like going back to the person who comes in tears. And in fact, I actually had this one younger patient, I think he was early 30s, and he actually mentioned if somebody else could please my wife, I would allow them to. And that was,
heartbreaking.
Basically, when we have men who are broken, who are in that state, we have to support them. And yes, we have saved marriages. Sadly, there have been people who come too late, so their marriages were not saved, but we have saved marriages, definitely.
I think I mentioned this to you before, that I was hitting 100 kgs and then I went to 45. Yeah. And obesity is a very common issue that we have now. How does obesity affect men's health and how does it affect sex?
Obesity basically brings with it the metabolic syndrome, where you still have other issues, insulin resistance and so forth. So these men usually have diabetes or insulin resistance. They might have hypertension, high blood pressure. They might have other issues as well. All of that is directly going to influence their performance in terms of erection strength and so forth. But obesity also increases the storage of the processing of estrogen. We have men who are obese. Usually they have higher levels of estrogen. So that would definitely cause them to have lower sexual drive and being unable to perform.
Let's talk a little bit about prostate health now.
Prostate health in general, it's pretty vague, to be honest. It's to do with being healthy lifestyle and so forth, like adequate sleep, this, that, and everything. Substances play a big role, smoking, alcohol, and so forth. So try to stay away from that. When it comes to masturbation and stuff like that, I'm still not convinced regarding that. But in regards to prostate health, being healthy is very important. And also having regular checkups. So like the first thing that we do in our setting is we do PSA, which is the prostate specific antigen, which is a tumor marker. They do have more frequent urination, nighttime urination. They have incomplete voiding where they go to the they try to urinate and then they come out of the bathroom, they have to go back in again, and the stream is poor and stuff like that. So all of these are warning signs and symptoms. So we have to get checked. It doesn't mean it's cancer or anything like that. It just means that the prostate is enlarging. It's compressing the urethra from the bladder going down to the penis. In regards to prostate health, being healthy is very important. So being healthy is more important than certain specific magical sort of things like that people would prescribe for prostate health.
I wanted to explore a little bit about low libido and about asexualism. Can a man be asexual?
Yes, a man can be asexual. I have not met an asexual man in my life before. Having worked in psychiatry, having worked in men's health, I have not met one. So I would say it's fairly rare. There are self-proclaimed people on the internet who claim they are asexual. I think it's usually women, but I haven't not come across them before.
Okay, just to cover a little bit about shame. So to anyone who's listening, they have fears or they have doubts, but there is a shame about approaching this topic. So what would be the next step?
I think the next step is for them to realize they're not alone, that a lot of people are affected by this. It is actually a very common issue. It is just that it's swept under the rug and everybody's like stigmatizing it. So you're not alone. That's number one. Yes, educate yourself. But the problem with educating yourself too much is there's a lot of misinformation outside. So that's a bit dangerous as well. I would say it would be best to see a professional, because knowing that you have this problem and understand, and that's number one, you already know that and you accept it. And the second thing is that if you're trying to navigate this whole like intense amount of information and everything, it's going to be overwhelming. And a lot of times you will feel even worse, or you'll be misguided, because there are a lot of people trying to make the quick dollar or whatever out there. They're trying to make profit, and profit is their main driving goal. And after you've convinced yourself, you'll be surprised. Everybody is going to welcome you with open arms, and we're actually been in your position as well. And so we are treating you, but we're also patients at the same time. And we're also men. That's why we only have male staff and only men to make the environment comfortable. We're not trying to say that like we're just like pro men. No, it's just that these things are embarrassing for a lot of men. So we want to make it comfortable for you.
One thing I wanted to ask you from the first time we connected is that this is not just a profession for you. You're very passionate about helping men. What drives your passion?
I'm a man. I'm 44 years old. And like I said, I want to live till I'm 120. No man is perfect, and everybody is going to be experiencing performance issues throughout their lifetime. I always say in Malay, kita menunggu masa saja. So we're just waiting for our time. So with that in mind, men are underrepresented. There's still the inequality there. But because society is such, I'm fearful of what the next 20 years is going to do to men. We are going to have a very passive society, and these men are going to have so many issues that it's going to be quite difficult to help them. That is why now we have to have this movement to make men again, but in a good way, not in that toxic masculinity sort of way. So I'm trying to create a safe space. I'm a firm believer in husband and wife sort of thing, or like partners and everything. I'm a husband myself, and so I really believe in that. And we're all just trying to survive in society with all our issues and all our problems. So helping to support them through that is a passion of mine.
There's definitely a lot more that we need to cover, but we have reached the top of the hour. But I want to ask you a question that I ask all guests who come on this show. If you had one wish to make the planet a better place, what would it be?
That's really tough. One wish. This is going to sound very idealistic, but I would say affordable healthcare to all, or even healthcare that is available to all on an equal basis.
That's very important and a very noble thing. Well, Dr. Rakesh Subbiah, thank you for being on our show today.
You're welcome.
And this is The Scented Edge, and I'm Dr. Manju Appathurai, and that's a wrap. Well, thank you for joining me at The Edge. Now, the stories and opinions shared by my guest are theirs alone. They are raw, personal, and do not necessarily reflect my own views or professional stance. I present these dialogues as lived realities, not absolute truth. It's for you to examine, challenge, and interpret. Like any investigation into the human condition, the evidence is laid bare. what you take away from it is entirely up to you. Once again, this podcast is supported by Work. Work is not just a co-working space, it's an ecosystem built for human connection. So whether you're an established entity or a startup, find space to grow at work. Okay, be sure to turn on the notification bell icon for this podcast. And here's a surprise. Please like, subscribe, comment, and share. And if you do all four, there's a mystery gift potentially waiting for you. I am Dr. Manju Appathurai. Until the next time, stay centered, but keep your edge.